Mary, Michelle, and Stormy is our videotaper today. We are going to be demonstrating how to don the PAPR, how to doff the PAPR, and how to clean the PAPR. And just so everybody is aware, our new process beginning this week is going to be that we are using the PAPRs when we're doing procedures. The rationale behind using the PAPRs is to reduce the amount of PPE that we're using. So even though we have been doing this previously using N95 masks, that has still been a safe procedure, but we are using the PAPRs now to reduce the amount of PPE that we're using. So Michelle is going to place the PAPR on here. I'm going to walk her through the process. The first part of the process is taking off your badge and anything that could kind of get a little contaminated when you go into the room. So she's already done that. Removing your cell phone, any jewelry. If you have long hair, you're going to tie it back. Secure your eyeglasses if you have them in place, and you don't need to use protective eyewear because the PAPR is going to cover your face. And then you're going to perform hand hygiene using an alcohol-based hand rub, so just our regular hand sanitizer. And then we're going to place the PAPR. So a couple things about it. First of all, we're keeping this in the PCIU equipment room. There's a couple different kinds, but they both work in the same way. There's one with this white hood and another one with kind of an army green hood. Both work the same way, so both are completely acceptable to use. And so you're gonna have a buddy when you place this on to make sure that they can help you with securing everything. And so I am going to be Michelle's buddy and help her to put on the PAPR. Okay, so I'm going to hold this, and you can take each strap and place it around your waist and just clip it up. There you go. Some stuff. Perfect, and then tighten that to your comfort. How do you clip it? Oh, there it is. Perfect. The PAPR also comes with a battery, which I'm going to go ahead and clip into Michelle's belt. There we go. Good. Okay, so I'm going to clip this battery into her belt here. Excellent. And then PAPRs have this little plug-in which plugs right into the battery here. So I'm going to go ahead and plug this in to the little 3-prong port here. Then we're going to actually test out the PAPR to make sure that it's working okay. You will be able to hear it, and you turn it on by pressing this button on the battery. And you can hear it sounds like a quiet vacuum. So we can turn that off for now. Now Michelle would go ahead and put on an isolation gown, and then we'll go ahead and put on the hood. So before you put on the hood, you want to do hand hygiene again with a little bit of alcohol rub. And then inside the hood are 2 kind of flanges. So you just kind of get yourself ready and put that on there. Pull down, pull the lower one. Inside, you can feel at the top there's also a ring that you can kind of adjust. So if it's smushing too much against your face, you can actually kind of adjust the ring at the top to push it out. Perfect. So when you're feeling comfortable, like it's on properly, we go ahead and plug this into the back here. And then turn on our PAPR. And then feel that
Nice
kind of working? So it's going to blow kind of some cool air through. Sorry, one other thing. The PAPR will have sometimes these little plugs in where the filters are. Just make sure those are removed also. We'll take these out now, and I don't think they should be in anymore. Okay. And then finally, the last thing that you're going to do before you go into the room is just make sure that when you're wearing your gown, these two flanges, the inside flange should be inside of the gown and the outside can hang out over top of the gown. And then Michelle is ready to go in and perform whatever procedure she needs to perform. The procedures that we're going to be using these with is when we're doing bronchs, if we are doing bedside tracheostomy, possibly intubating a patient in a non-emergent fashion, or if we have a little bit of time to prepare for it. So 3 people going into the room, the nurse, the RT, and the physician or provider, and they can all be wearing one of these. We'll have enough for everyone. All right, very good. Okay, so now Michelle has finished bronching her patient, and she's ready to doff the PAPR. So again, having her buddy, what she's going to do is we're both going to perform our hand hygiene. The buddy is going to be wearing gloves for this. We are going to assist Michelle with taking off the isolation gown. She's just going to tear it off. We'll get rid of that. You are going to, I as the buddy am going to disconnect the hose at the hood. So right up here, I'm going to, by pushing this blue thing in, I can disconnect the hose.
Oh, hot again.
Becomes hot. And then Michelle is going to remove the hood. So she's going to lean forward over the table. We're going to have 2 tables, a dirty table and a clean table. She's going to lean forward and pull the hood off over her head. Place it onto the table. Perfect. Then she would do hand hygiene, and then I will assist her with taking off by holding the PAPR in the back, and she can take off the belt, and so that it doesn't fall, I kind of have it and place it onto the table as well. Perfect. Then she can remove whatever else she needs to and perform hand hygiene. Now we're ready to clean our equipment. So we're going to have 2 separate tables. We have our dirty table, which has the dirty equipment on it, and then we're going to use another clean table also. And so for this, we're going to put on gloves after we wash our hands. You can use the Clorox bleach wipes for this one. And the first thing we're going to do is disconnect the battery. And we're going to use a Clorox wipe to clean the battery. Just making sure to get in everywhere. I'm going to go kind of quick just because this is a video, but then you're going to place that onto your clean table. You're going to discard that wipe and take a new wipe. You're going to start with the hose at the base of the unit, and you're going to wipe it all the way down to the end. This is going to take a little bit of time because it's kind of rigid, but ridged, but you're going to wipe it all the way down to the end here. Then you're going to take a new wipe and you're going to clean around the PAPR. So cleaning all around in the PAPR. Again, I'm just going to go through this pretty quickly for the purposes of this video, but clean the belt, and clean the power cord. And then put this onto your clean table. And then lastly, you are going to clean the hood. And this is a two-step process. So for the hood, you're going to start at the base of the collar and wipe around the entire exterior of the collar. So you're going to start here. Remember, there's two flanges, so start inside. You're going to wipe at the base and come all the way down, around. And then you're going to start up here again on the outer flange and wipe all the way down and around. You're going to take another new wipe and you're going to clean inside of the PAPR. So clean inside all of the transparent face shield area and then the inside of the hood as well. And then when that's clean, you're going to go ahead and place that onto your clean table to dry. You can take a look to make sure that you're leaving it for the correct amount of dry time using the bleach wipes, and let this sit for that amount of time, and then once it has gone through its dry time, we're going to put this equipment back into the PCIU equipment room on the top shelf. And so I think the buddy who's helping people to don and doff their PPE can be responsible for just making sure that everything gets all cleaned up afterwards and put back into the correct location. So if you have any questions, please let me know, but these little tip sheets can kind of walk you through the process of donning, doffing, and cleaning the PAPR equipment. That's all I have for you guys. Thank you.